I'm Tawara Goode, and I am an associate professor at Georgetown University Medical Center, Center for Child and Human Development. I also am the director of the Georgetown University National Center for Cultural Competence and the University Center for Excellence in Developmental Disabilities. I'm pleased to say I also share an exciting role with Dr. Mary Beth Bruder, and I am co-director with Mary Beth for the Early Childhood Intervention Personnel Center for Equity, which is funded by the Office of Special Education Program. So in my position, both at the University Center for Excellence in Developmental Disabilities and our National Center for Cultural Competence, a lot of the focus has been on really understanding the role of culture and language in supports and services for persons who experience intellectual, developmental, neurodevelopmental disabilities, their families, within the context of the communities in which they live. I've given the lectures to blend with leadership education and neurodevelopmental disabilities for these programs for many years. And my lecture today is really to help trainees across multiple disciplines to really understand, what does culture mean? What does culture mean within the context of a person who has a disability? What it means within the context of the family? What that also means, again, looking at culture within the context of the community in which the person and the family live. And then all surrounding them in terms of the various systems that provide an array of supports and services. What does culture mean in terms of mental health system, the healthcare system, social services? Because all of these come together that will impact the person with the disability across the lifespan, the family, and the supports and services that are necessary. As we think about cultural competence and linguistic competence, they are evidence-based practices that we know that help address disparities, help improve diversity, equity, and inclusion. And again, I want to emphasize that they are evidence-based practices. And so as we think about anyone who's working in the field, the capacity to really understand culture and language and how that impacts service delivery systems, whether it's education, again, whether it's health, whether it's early intervention, is a key area of knowledge and skill for all practicing professionals. So at the Georgetown University National Center for Cultural Competence, this is the way we think of it in terms of a framework. That as we think about cultural competence, it really is the capacity of organizations and the personnel that work there. First of all, to have a shared understanding of values, and then to really be able to look at the capacity of the organization overall to have policies, structures, practices, behaviors, and attitudes that will enable anyone within the organization, whatever it may be, to work effectively cross-culturally. And when we think about linguistic competence, it's related and quite similar. It really is the capacity of an organization and its personnel to be able to convey and receive information, and to convey information in a manner that's easily understood. And this would be across many different groups. That would include people who speak languages other than English. It may include people who have disabilities and have communication needs. It may indeed include individuals who may or may not be literate either in English or their language of origin. And how we support and communicate across these domains is really key and critical in all work that we do in support of people with disabilities and their families.